This segment is brought to you by the Southeastern Spine Institute.
Welcome to Southeastern Studios, where we learn about the latest in medical technologies and sit down with physicians who are prominent in their field. All right, I'm joined today by Dr. Ryan Nobles from Southeastern Spine Institute. How are you doing?
Doing great.
That is wonderful to hear. I want you to tell me a little bit about your background and how you got to where you are today.
I'm originally from upstate South Carolina.
Where from?
From Lawrence, South Carolina.
Okay.
About 30 miles south of Greenville. So I stayed in the area after high school and attended Presbyterian College, and then made my way to Medical University of South Carolina for medical school. Loved Charleston so much I decided to stay for residency. Did my pain fellowship training in Atlanta at Emory University, and then returned to MUSC for a few years as an assistant professor. While over there, Dr. Mark Netherton got in touch with me and wanted me to join his practice here at Southeastern Spine, and I was happy to come aboard.
Now, did you have a moment where you kind of knew that you wanted to get into this field?
I originally wanted to practice family medicine, but was drawn to the interventions with anesthesiology. Pain medicine was a good bridge between the two specialties, where I could still have a relationship with patients, but also practice interventions.
Now, what is an intervention for somebody that does not know anything about your field?
So here at Southeastern Spine, we do a variety of procedures to help alleviate pain, to try to keep people away from the operating room if possible. So we do epidural steroid injections, we do facet blocks, which facets are the joints between the vertebra, so a lot of times those are a culprit of major back pain. We also do radiofrequency ablations, also known as rhizotomies. What we do there is we cauterize the nerves going to some of the joints in the back, but that can give patients relief for up to a year without having to consider any other surgical interventions.
I was going to say, what is a typical candidate for someone getting treated by you?
It actually runs the whole gamut of all the patients we see here at Southeastern Spine. So some people who present initially can be seen first in pain management. If those interventions are not successful, usually we'll send them to the surgeons for evaluation. Also, some patients who have had surgery and may have had pain return in a different area, we can treat those patients as well.
I would have to imagine that what you do is very interesting, to be able to watch people who are in so much pain and then get relief. What is that like?
It's very gratifying, and we try to seek a balance between medication prescription and our interventions. As you know, there's been a lot of new laws enacted in the state of South Carolina, in addition to a federal level regarding opioid medication. So at Southeastern Spine, we try to find a balance between safe alternative medications in combination with interventional techniques to limit the use of opioid medication prescriptions.
And that's something you're very passionate about, right?
Yes. We like to have safe alternatives for patients that will not require them to take pain medicine for a long-term basis. So usually with some interventional therapy, we can get you on a path to healing that requires limited use of medications going forward.
Has there been anything that's, surprised you working in this industry? I know that new technology comes out all the time.
So also one thing we offer is spinal cord stimulation. So for patients who have persistent back pain and leg pain that's not been relieved by a surgery, or who aren't good surgical candidates, it's a safe outpatient interventional procedure that can alleviate pain. And due to new advances, we can also treat groin pain, knee pain, foot pain, hip pain. So it's not just isolated to the low back and the legs.
Not just spines.
Correct. We can treat all kinds of different pain problems.
And what do you enjoy about working at Southeastern Spine?
There's a great camaraderie here, and it's very convenient for the patients. So this is one of the only practices where a patient can get an MRI, be seen by a surgeon, be sent down for an injection all on the same day. Most other providers' offices are spread between different specialties in different areas, but here everything's under one roof, and we can perform everything you need in a single day.
That is fantastic. Now, you're taking new patients, correct?
Absolutely.
All right, if you want to get in contact with him, you can go to southeasternspine.com. Thank you for joining us for another segment from Southeastern Studios, and as always, you can go to southeasternspine.com for more information.